Okay, this morning we're going to be demonstrating how to mix insulins, regular and NPH insulin. So I'm going to start at my nurse's station. So at the nurse's station I'm going to pull up my patient's chart and I'm going to make sure that my MAR and my MAR matches what the doctor has ordered. So I'm going to start with my doctor's orders, and I've got Anna Taylor, Dr. P. Potter, date of birth 4/24/1991, medical record 3335899, no known drug allergies, diagnosis uncontrolled diabetes 2, right hip replacement. And so I have, I'm going to just double check my MAR real quick. I've got Anna Taylor, date of birth 4/24/1991, medical record 3335899, and no known drug allergies, Dr. P. Potter, uncontrolled diabetes 2, right hip replacement, and no known drug allergies. So all of that matches, but we will verify that with each check. So I've got Anna Taylor, date of birth 4/24/1991, no known drug allergies, admit with uncontrolled diabetes and right hip replacement, vital signs Q4 hours, diet 1800 calorie ADA, activity is out of bed to chair BID, lab CBC with differential, CRP, a platelet count, renal and hepatic labs, potassium, PT INR in the AM, AccuChecks before meals and at bedtime, and then I have my medications. So these are just the same labs here that they had ordered there. So now I'm going to go ahead and start. This is what I'm going to be looking at the labs as far as today. My patient's going to be getting insulin and Lovenox, so I need to make sure I've looked at the complete blood count, look at the platelet count. These can affect the renal, hepatic, potassium levels, and then the PTINR in the AM after we start the Lovenox, just because it is an anticoagulant, just to see where our bleeding time is. I'm going to start with my medications. Anna Taylor, date of birth 4/24/1991, no known drug allergies. The first medication is regular insulin, 8 units mixed with NPH insulin, 12 units subcutaneous before breakfast and evening meal. So I'm going to go to my MAR. I have Anna Taylor, date of birth 4/24/1991, known drug allergies. Regular insulin, 8 units mixed with NPH insulin, 12 units subcutaneous before breakfast and evening meal. So it's to be given twice. So it's on my MAR for 9 o'clock and 1800, so that is correct. Go back to my doctor's orders. I have Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have Lovenox 40 milligrams subcutaneous daily. Go to my MAR, and I have Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have Lovenox 40 milligrams subcutaneous daily, and it is scheduled at 12 o'clock. So this morning I'm just going to be giving the 9 o'clock dose. So I will come back, and so I've made sure that this is correct. So I'm going to go ahead and verify. Let me just go back to my doctor's orders and make sure there's not any other, and there's not. So I'm going to come to the top here, and I'm going to put my initials, or my J, and then Buckskimper. My credentials, so you would put your credentials. Okay, and then I'm going to go down to the bottom, and I'm going to put my J. Buckskimper, my title, and my initials. That way anybody can tell. So if they see JB here and they're giving 1800, then they will know who gave it last in case there was any questions or anything like that, and then so they can verify who JB is in any of these that I'm giving. So again, this morning I'm just going to be giving the 9 o'clock dose. but I made sure my MAR was correct with my doctor's order. So I verified it, and then I put my information down here, okay? So I'm gonna go ahead and close out my chart at the nurse's station, and I'm gonna go to go into the med room. Once I go into the med room, I'm gonna go ahead and do my medical hand wash. As a student, the nurse will pull your medications and put them in a drawer for you, and so you'll need to find the drawer that matches your patient. And so we're going to go ahead and start doing our 5 rights, 3 checks. Okay, so I've got the right. I got to make sure I've got my medication that I have here, and I've got to make sure that I've got my syringe. So I'm going to start my first check. So I need to pull my computer back up. Okay. And so I'm in the med room, I did my medical hand wash, and I'm going to start my 5 rights, 3 checks. Okay, so I have Anna Taylor, date of birth 4/24/1991, no known drug allergies. Says regular insulin 8 units mixed with NPH insulin 12 units subcutaneous before breakfast and evening meals. I'm going to be giving the 9 o'clock dose. And so in my hand, I have Practi regular insulin. It's U100, so I've got regular insulin. I'm going to be giving 8 units. And the expiration date is 3/22/2026, so everything is intact with that. And it's going to be sub-Q. We're going to mix it with the NPH insulin. So I have Practi regular NPH insulin U100. NPH insulin U100. I'm going to give 12 units of this. And the expiration date is 20/26, okay? And so that is intact. And I also have my insulin syringe. This is a, it says safety insulin syringe, okay? And the U100 insulin here. The expiration date is 11/30/2025, and it's intact, so I've checked that. So I've done my first check, and I'm going to go ahead and come over here, and we're going to start mixing. So we're going to go ahead and, with the NPH insulin, you need to roll it because the precipitate, we need to mix it with the solute, and so we're just going to roll it. You don't shake it. Okay, make sure all of it is mixed. Okay, and we're going to, I'll get this in trash here in just a little bit. Okay, so when you're mixing insulin, you want to mix clear to cloudy, okay? So that means I'm going to put the air in my cloudy first, because you always want to give and take so you can equalize the vial here. And so for the NPH insulin, it says I'm going to be doing 12 units. So I'm going to go ahead and pull back to 12. Okay, 10, 11, 12 on that. You have to be very careful with this needle. And without touching my needle, without touching the solution, I'm going to go ahead and put my air in, take it out, okay? And then it says that I'm supposed to be using 8 units of my regular. So I'm going to get 8 units, 5, 6, 7, 5, 6, 7, 8. Again, being very careful not to bend the needle. So I'm going to pull back to to my 8 units. Make sure I get any kind of bubbles out of there. Okay. Okay, and I'm going to make sure that I have 5, 6, 7, 8 units. Okay. Then I have to have 2 licensed personnel verify, so they tell me what you see. They should tell me they see regular insulin and it is 8 units. And so that matches what I'm supposed to have. I'm going to get a second licensed personnel. What do you see? They should tell me they see 8 units, or regular insulin, 8 units. So that tells me I have the correct amount. Okay. So I'm going to, because I've probably been crossing over that, and so with this, we're going to be giving I'm going to re-clean that again. So we're going to be giving the 12 units. So 8 plus 12 is 20. So I've already put the 12 units in. And I need to very carefully, I cannot overdraw. I need to pull back my 12 units, so that would give me a total of 20. Because I have 8 of regular and 12. Okay, so there is 20. So now, again, I'm going to have my licensed personnel tell me what they see. They see NPH insulin and they see 20 units, okay? That's correct. That means I did my math correctly, because we did 8 and then we did 12, which gives us our 20. I'm going to ask my second licensed personnel, what do you see? They say NPH insulin 20. Again, that tells me that I got the correct amount. And so very carefully, without touching, I'm going to go ahead and recap my, okay? And making sure I still have my 20. And now I need to label. So with insulin, you do clear to cloudy, because we don't want, because NPH, we do not want it in the regular. So we put the air in the cloudy first, then we put the air in our regular, drew it up, had to verify it, and then went to our NPH insulin, drew up our 12, which was the total of 20, and had 2 personnel verify it again. So I have regular insulin, 8 units, and I have NPH insulin, 12 units, and that's going to give me a total of 20 units. And this is going to be sub-Q, okay? This is the 9 o'clock dose, and I'm putting my initials on there, okay? So regular insulin, 8 units, and NPH insulin, 12 units, so 20 units. Take this off, and I want to put it somewhere where I can still read my label or read my syringe. So this is right, I can still tell how much I have in there, okay? Some people will actually put it on the lid. So I want to make sure that I can still read how much is in my syringe. Okay, and just make sure I still have 20. Okay. So that is my first check. And now I'm going to do my second check, because that's the only medication that we're giving this morning. So I have Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have regular insulin, 8 units, mixed with NPH insulin, 12 units, subcutaneous, before breakfast and evening meal. I'm giving the 9 o'clock dose. And in my hand, I have my Practi regular insulin U100, and expiration was 3/22 of 26, and I drew up 8 units of my regular insulin. And I have my Practi NPH insulin U100. Expiration date was 20 of 26. Both of them were intact, and I'm giving the 12 units of the Practi NPH insulin, so it gave me a total of 20 units. We're giving that sub-Q before breakfast and evening meal. Let me get that's the 9 o'clock dose. And so then in my syringe, let me get that little extra pulled off of there. In my syringe, I have regular insulin 8 units, and I have NPH insulin 12 units, which gave me a total of 20 units. And I still have 20 units. It's going to be the 9 o'clock dose, and it's got my initials, and it's going to be sub-Q. Okay, so I've read my vials, and I read my syringe as well. So that was my second check. I do have other medications, but those are my noon medications. Before I finish here, I'm going to go ahead and, because insulin, we've got an expiration for the vial, but once it's open, then it needs to be date timed and initialed, because according to the hospital policy and procedure, most of the time this is only good once you've opened it for 30 days. So I'm going to put the date and the time and my initials. Okay? That way the next person that uses this, when they use it, they've got to check, make sure it's still within the time frame here and the vial is still good. And so we're going to do that with both. Time and my initials. Okay, so we did our first and second checks. Now we're going to go ahead and shut down our computer here at the nurse's station, and I'm going to go ahead and I'm going to be leaving the med room, so I'm going to go ahead and do a medical hand wash. Leave my extra there up. I'm going to get all my trash, and I didn't need gloves because I wasn't touching the medication. So as I'm going to leave the med room and take my trash. And I'm going to go to the patient's room. So knock, knock, knock. Good morning. My name is Jan Bucks-Kemper. I'm a registered nurse, and I'm going to be giving you your medications this morning. So let me get my hands washed, walk into the room. I'm going to pull up the computer, and then we're going to go over what we're going to be doing. Okay. So I've got my MAR, and so I'm gonna, can you tell me your name and your date of birth? Anna Taylor, date of birth 4/24/1991, okay. Anna Taylor, date of birth 4/24/1991, and 335-899, 333-5899, okay. And are you allergic to any kind of medications? You're not allergic to any medications? Okay, and no known drug allergies, so that matches. And so I'm going to go ahead and put my scan right here. And we're going to go ahead and scan your armband, okay? And that matches, so we are good. Okay, Ms. Taylor, we're going to be doing, I'm going to do my third check on my medication, and then we're going to explain it to you, and we're going to talk about where to give the insulin, okay? Okay, So I've got Anna Taylor, date of birth 4/24/1991, no known drug allergies. I've got regular insulin 8 units mixed with NPH insulin 12 units, subcutaneous before breakfast and evening meal. I'm going to be giving the 9 o'clock 9 o'clock dose. And so in my hand I have regular insulin at U100. Okay, expiration was 3/22/26. I've date, time, and initialed it so they know when it's good within the 30 days, okay? That matches. And then I have my NPH insulin U100, 20/26. Again, it's date, time for the 30 days. And we're going to be giving 12 units. We're going to be giving these sub-Q before breakfast and evening meal at 9 o'clock. So in my hand, in my syringe, I have regular insulin 8 units. I have NPH insulin 12 units. So that gives me a total of 20 units, and that would be 8 and 12. That's 20 units. I have 20 units sub-Q. It's going to be the 9 o'clock dose, my initials. And I need to make sure I still have 20 units. And I do. So I'm going to go ahead and scan both of my vials. Okay, and they may not scan, so now I need to go ahead and write the number in there. Okay, so that was for my NPH insulin. Then I need to also scan my regular insulin. Okay, and that one's not going to scan either, so I'm going to go ahead and add this number in there. Okay, so I'm making sure those numbers match. Okay, normally they would scan. Okay, so I've got both of these medications scanned, and I have checked to make sure I have my 20 units, and read to make sure what I have in my insulin syringe. Okay, so now that I've done my third check, I'm going to come over here and Miss Taylor, so we are going to be giving you your insulin. It's regular insulin, and we also have our NPH insulin. So regular insulin is a short-acting, and the NPH insulin is an intermediate-acting. The onset for the regular insulin is 30 to 60 minutes, and then the onset for the NPH is 1 to 2. The peak for the regular is 2 to 4, and the peak for the NPH insulin is 4 to 12. And then the duration for the regular insulin is 5 to 7, or some 6 to 8, depending on what book you use. And then the NPH insulin is 18 to 24. So it's covering you for the 24 hours, the NPH insulin is. But with the regular insulin, since it's short acting, we need to make sure that you're going to have breakfast this morning, because we're going to be giving this before meals. So, and then I noticed that the breakfast meal is coming in, so we want to make sure you eat that. And then I'll be coming back in about 30 minutes just to make sure that you aren't having any kind of reaction. So, you know you're diabetic. Have you been getting insulin at home? Yes? Okay, so you normally do NPH, but in the hospital we added the regular insulin. Okay, so we're giving this to you for your diabetes, and so we're going to be watching, and this is because your blood sugar is too high. We did check your blood sugar before we came in. They had the finger stick this morning, and it was all within the normal range, which that's good because we want to leave it there. Now, if your blood sugar was too low, then we would call the physician before we gave it, but it's all good. So with your diabetes, you know, you've got, if your blood sugar is too high, you can have confusion, dizziness, disoriented, and so we don't want that to happen, okay? Because then it can start affecting some of your other organs. You know, you might have noticed that you had excessive thirst, excessive hunger, and then with that, excessive urination. And so those are all kind of some signs and symptoms of hyperglycemia, high blood sugar. And so when we give this, we want to watch for hypoglycemia, which is low blood sugar. And so again, it can kind of mimic the same things where you're having some confusion, you may have some sweating, disoriented, and restless. So those are some of the things that we're going to be watching for. And in that 30 minutes, we're going to come back because that's when the onset can start with this insulin, to make sure you're not having any problems with it being low. At home, you need to make sure you keep some little sugar candies. That's a good way to help get your sugar up if you feel like it's too low, okay, when you take it. All right, so we've talked a little bit about that. The sites that we can give it is in your the back part of your arm. So we would find the chromium process, and we're going to go down to the elbow and anywhere on the back side of your arm here. We would just check to make sure, and that's on both sides. There's like 8 spots we can give. I'm going to go ahead and move the bed up. We can also give it in your abdomen, and so we've provided for privacy. Now, where do you give your insulin at home? You give it in your abdomen? Okay, so just remember that you've got 4 different quadrants, okay? Your belly button, and you're going to draw an imaginary line. So you've got spots in each one of these. You just want to stay about 2 inches away from the umbilicus, okay? And then also we can do it in your thigh. So sometimes patients prefer to do it, might be a little easier there. So hand above the knee, at the groin, and anywhere on top of here that you can pinch that subcutaneous tissue, okay? So those are areas that typically patients do at home. So we're going to stick to the arm. So do you know where they gave that insulin last? It was in the left arm? Okay, so we're going to give it in the right arm. Okay, so I'm going to go ahead and wash my hands again real quick. Okay, so we scan that medication, we scan the armband, make sure we have the right patient for the right med. We've done our teaching. We're going to go ahead and always make sure we have gloves on when we give an injection. And then we know that we never recap a needle that has been used for injection. Okay, just checking the integrity of my gloves. You never want to leave your medications unattended. Okay. All right, so I've got my insulin, I've got my, we're going to do this, and because that needle is so small, subcutaneous can be at a 45 to 90 degree angle, but it's recommended for insulin to be given at a 90 degree angle. And so we're going to go ahead and, so I'm going to put this over here in this hand right here. And I'm going to pinch up. We're going to work in a circular motion. Okay. I'm going to pull this out. Okay. We want to keep the pinch the whole time. Okay. A quick darting motion. 1, 2, 3. We're going to go ahead and give. We're going to go ahead and take out. We're going to go ahead and deploy our safety device on there, and then we're going to go straight to the sharps container, okay? And I don't want to rub, and just making sure that it's not bleeding, okay? Typically they don't, okay? And so took my gloves off. Do a medical hand wash. Okay, you doing okay? Okay, like I said, we're going to come back in 30 minutes, and we're going to be checking, making sure you're not having any problems with hypoglycemia. So I'm going to go ahead and lower the bed, make sure the side rails are up ×2, the wheels are locked, your call light is right here, and I am going to come over here and I'm going to document. So So in my box where my 9 o'clock is, I'm gonna go ahead and put my initials saying that I gave that medication. And then I need to put where I gave it, and so we gave it into your right upper arm, okay? And in the hospital, the computers have a drop down where you can actually specifically put, but if not, you have to actually document on your form where you gave it, that I gave it, JB, and then you would need to save it. Also, one of the other things that is real important that, and it's not done in this spot, but there's another drop-down box that talks about that who did we teach, okay? We taught the patient, and what was their understanding about that. So did you have any questions about the insulin? Okay, well if you do, just let us know. And so they understood the teaching on that. So I've made sure that everything is complete. I've saved my documentation by hitting the information there. And so once we've done that, I'm going to go ahead and shut down my computer, okay? And I've got made sure the bed was in a low position, side rails up ×2. I want to make sure that we get our tray back where it needs to be. Yep. There we go. Okay, and like I said, we're gonna have your tray as soon as I leave and put my med tray up. I'm gonna come back in with your breakfast tray, okay? Because we need you to eat within 30 minutes of getting that. And so, do you need anything? Okay. So I'm gonna wash my hands as I leave the room.